Okay, so today's topic is cell wall inhibitors. And cell wall inhibitors include the so it looks like it doesn't record the lecture. Okay, anyway, so let's continue. So the cell wall inhibitors include several groups. Penicillins, and penicillins are the most safe antibiotics and the first group of antibiotics that was discovered by Fleming. Then the second group is cephalosporins, and cephalosporins were synthesized as a replacement for the penicillins to increase the spectrum of action and also to fight the resistance to the of the bacteria to penicillins, and we will talk about that a little bit more later. Then the fourth group is carbapenems, and carbapenems are all injectables and have the broadest spectrum of action uh, of all cell wall synthesis inhibitors, and monobactams are the uh, uh, antibiotics with a uh, narrow spectrum of action, and used seldomly. So, and also we have beta-lactamase inhibitors that are combined with the penicillins to broaden the spectrum of action of penicillins, and also other antibiotics of different chemical structure that also have the same mechanism of action as these four groups. So mostly vancomycin, but also other newer antibiotics with a broader spectrum of action are included here. And we will start with the penicillin. So and the penicillin have the beta-lactam ring that is required for the activity, and the chemical structure of the penicillins is 6-aminopenicillinic acid. So we have amino group at position 6, and we have penicillinic acid, so this is the chain of the penicillinic acid. So it is a weak organic acid with substitute at the amino group that determines the enzymatic stability and also affects the antibacterial spectra. Also, but this is a common group or common structure for the all penicillinic acid. So the difference inside the group is only with the this uh, uh, with the group at the amino uh, uh, of at the amino nitrogen. So and also the beta-lactam ring can be hydrolyzed by the bacterial penicillinases that will destroy the antibiotic activity. That is why some when uh, some penicillins are combined with beta-lactamase inhibitors that inhibit the enzyme so it is not destroying this link. So the mechanism of action is based on the uh, on the interaction uh, with the uh, cytoplasmic peptides, including N-acetylmuramic acid and peptide chains that bind these acids will bind with the penicillin, and they will block the synthesis of the peptidoglycan, that is outer membrane of the cytoplasm, that is seen only in bacteria, mostly gram-positive bacteria, and that is why this allows to dye them with a gram stain. So this is blocked by the penicillin and other beta-lactam antibiotics. So this is the mechanism of action. Then the antibacterial spectrum includes of the natural penicillins like penicillin G and penicillin V, includes gram-positive Streptococcus pneumoniae. So this is a common cause of bacterial pneumonia in adults and children, and there is a resistance to the penicillin G, and that is why the penicillin G nowadays is not used widely. Then Streptococcus pyogenes and Streptococcus viridans groups are two other bacteria of the same family, and pyogenes will increase the temperature and lead to the fever, and viridans is another one that is may lead to the different diseases, not only pneumococcal, but Streptococcus pneumonia is mostly leads to the streptococcal pneumonia. So mostly is a pneumonial disease only. Viridans groups may lead to other diseases as well. Then there is also Staphylococcus aureus, is not listed here, but is also covered by the natural penicillins. So Streptococcus aureus is part of the normal microflora, and there are also resistant strains of Staphylococcus aureus. So and these stains are called methicillin resistant stains. So it's called methicillin resistant Staphylococcus aureus. So these are not covered by the penicillins and also by any other beta-lactam antibiotics. So then gram positive bacills include Bacillus anthracis, that is the cause of anthrax. Anthrax is a very rare disease because there is no mutation, so and the disease is usually seen in cold countries where these bacills can survive in frozen soil with the bodies of the infected people. Uh, and there are not so many places for these bacteria to survive. So there are only 2 places on the planet that have the stains of these bacillus preserved for scientific purposes. So it's almost completely cleared. The surface of the earth is completely cleared from the anthrax, so that is why it's no more a disease of interest like it was like 25 years ago, for example. So we still uh, have had some anthrax outbreaks 25 years ago. Now I haven't seen any uh, in like 15 years, uh, so that is why uh, we no longer study this. So he is just listed uh, for the history. Then Corynebacterium diphtheria is also gram-positive, and diphtheria is a sexually sorry gonorrhea is sexually. So diphtheria is actually a common disease, and the sometimes seen in children. So and is still common in many countries, including Russia. Then, so Corynebacterium diphtheria is commonly seen in children because they don't wash hands before eating. So the hygiene usually is seen in those countries with a poor hygiene and what can be easily treated with the cleaning of clean food like the fresh food and also the GI disease. So the washing hands frequently and the general hygiene usually prevents the disease to spread. Then this was the gram-positive bacteria, and uh, the penicillins are mostly effective against gram-positive bacteria, and that is why uh, uh, drugs of choice for the treatment of the uh, gram-positive bacteria, including the Streptococcus pneumoniae, if the stains are not resistant to penicillins. Then the gram-negative bacteria include Neisseria gonorrhoeae, and Neisseria gonorrhoeae is uh, a sexually transmitted disease, one of the most common sexually transmitted diseases in the world, and Neisseria gonorrhoeae have uh, stains that produce penicillinases that are types or subtypes of the beta-lactamases, and they are resistant to penicillins. So that is why other more effective groups can be used, including cephalosporins and carbapenems. So and also uh, newborns will catch this disease while moving uh, through the vagina of the mother. So that is why newborns will have uh, eyes uh, so treated with the silver nitrate drops as a prophylaxis for the gonococcal ophthalmia in newborns, that is called blenaria. So blenaria is the form of the gonorrhea in newborns and children. So because children don't transmit it um, as a sexual transmitted disease, instead they can have a eye disease. So, and then Neisseria meningitidis is another Neisseria that leads to the meningitis, and this is not treated by the penicillins because they don't cross the blood-brain barrier. And even when if the meninges are inflamed, they cross during the inflammation, but once the disease subsides, inflammation subsides as well. That decreases concentration in the central nervous system, and that leads to the uh, uh, activation of the bacteria again. So that is why it's not effective in the long term. So then so only 2 gram negative, or actually 1 gram negative Neisseria is covered by the penicillins, by the unnatural penicillins. So that is why mostly it's gram positive bacteria. Then we have anaerobic Clostridium perfringens is a GI disease as well. Clostridium will go to the intestine and then make a hole in the intestine and go to the other organs like heart, liver, and will lead to the lung disease. So can be treated with the penicillin G. And then spearheads include Treponema pallidum, that is the cause of syphilis. Syphilis is also a sexually transmitted disease that can affect the whole body, and that is why it's hard to treat. And then Treponema pertuene lead to the yaws. A good news is that syphilis is not resistant to penicillins. That is why penicillin G is the and any other penicillin is the drug of choice for the syphilis, and very effective in the treatment. So treatment is usually several weeks up to 14 days, and longer up to 1 month for those with the uh, highly progressive disease. So depending on the severity of the disease, can be from 14 days to 1 month. And usually there are no relapses. So this is a spectrum of action of the natural penicillins, and it is very important to remember spectrum of action, so you know how to prescribe the drugs and recommend the drugs that are effective against the diseases. So, and also this is a basic spectrum, so we will add another new bacteria to the spectrum because broad spectrum penicillins have broader spectrum, so they include everything that is listed here, plus they include additional bacteria, so for example the ampicillin and amoxicillin are considered a broad spectrum, extended spectrum antibiotics, and additionally they cover enterococci, that is also gram positive, and Listeria monocytogenes. So Listeria will lead to the listeriosis, and Enterococci will lead to the intestine disease, so GI disease. Then they also cover the gram-negative bacteria, including Escherichia coli, that is a normal microflora of the intestine. Haemophilus influenza is a very small bacteria that cause a flu-like disease. Proteus mirabilis, so it's Proteus, leads to many diseases, and Salmonella typhi is also GI disease. Usually disease is because of the eating raw eggs or raw meat. So it's not recommended, especially for the pregnant women. Then the next group is anti-pseudomonal penicillins, and these include ticarcillin and piperacillin. So these two antibiotics, ticarcillin and piperacillin, additionally cover Enterobacter species, Escherichia coli the same as the previous, Proteus mirabilis the same as the previous, then other Haemophilus influenza the same as the previous. So additionally they cover only Pseudomonas aeruginosa. They don't cover by the Listeria monocytogenes and Enterococci, but they cover Enterobacter. So that is, names are common, but these are different species. But most importantly, they cover Pseudomonas aeruginosa, that is resistant to all other penicillins. So that is why it's very important, and mostly used for the treatment of Pseudomonas aeruginosa, because everything else can be treated with the ampicillin and amoxicillin. So ticarcillin and piperacillin are used only for the Pseudomonas aeruginosa. That is why they are called anti-pseudomonoic penicillin. So this is a third group, and there is also a fourth group that is resistant to the acid. So this group includes the anti-staphylococcal penicillins, because staphylococcus, sorry, not resistant to that, but actually resistant to the staphylococcal penicillinases. So it's dicloxacillin, methicillin, nafcillin, and oxacillin. So, and dicloxacillin is also stable to the acid, so it's not destroyed by the acid in the GI. But for example, natural penicillins are destroyed, like penicillin V, for example, and also, sorry, not penicillin V, penicillin G. Penicillin V is stable, but is not available in Russia. So these are stable to the penicillinases, dicloxacillin, methicillin, nafcillin, and oxacillin. So they don't require combination with the penicillinase inhibitors, clavulanic acid and tazobactam, unlike the amoxicillin and penicillin. So that is why. And amoxicillin and penicillin are not resistant to penicillinase. That is why they are combined with the penicillin with the beta-lactamase inhibitors. So clavulanic acid is a beta-lactamase inhibitor, and penicillinase is the type of the beta-lactamase, so subtype. So amoxicillin plus clavulanic acid and ampicillin plus sulbactam, and also they have the anti-pseudomonoic ticarcillin and piperacillin also have combination with the beta-lactamase inhibitors. So this makes them stable to penicillinase. And because of this, resistance is common now. So sometimes patients will require this to dispense them the dicastylene, piperacillin, amoxicillin, ampicillin that are uh, covered with the so the protected with the beta lactamase inhibitors. So they are more expensive and they have broader spectrum of antibiotics, or have a spectrum is the broadest, broader than the without these acids. So but also that leads to the they also kill more bacteria, and that leads to the dysbacteriosis, that is more severe dysbacteriosis. So that is why only this should be used. The combination with the beta lactamases should only be used. Amoxicillin plus clavulanic acid should only be used when the disease is caused by the resistant bacteria, so resistance to the amoxicillin alone. So but most of the time amoxicillin alone is enough. So there is no any purpose of dispensing combination with the clavulanic acid if amoxicillin alone is enough. So I've seen this many times. Physicians prescribe amoxiclav, that is a brand for the amoxicillin clavulanic acid, very expensive, 1000 rubles per 10 tablets, when you can buy amoxicillin for 100 rubles. So like 10 times cheaper and same effectiveness, provided amoxicillin is provided the bacteria does not produce beta lactamases or penicillinases that can destroy amoxicillin, and most of the bacteria doesn't. So that is why make sure to check. Okay, so then that is all for today. What are your questions?
We have no question.
No questions? Fatma, you don't have. Maybe other students have. Sukhaila?
No, I don't have.
Next week we have control oral.